Good morning. It's 10 a.m. and I'd like to call this meeting of the Health Sciences Committee to order. Winter, would you please take roll? Oh, did you?
Good morning, Regent Goodman. This is Winter. I'm waiting for a couple of your committee members to join up here so you have a quorum.
Okay, thank you. We will wait another minute then.
Okay, I'll let you know. Thank you. Hi, Chair Goodman. This is Winter. You do have a quorum now.
Thank you. Would you please take roll?
Yes. Chair Goodman?
Here.
Vice Chair Del Carlo? Here. Regent Breger?
Here.
Regent Perkins?
Here.
Regent Tarkanian? And you do have a quorum.
Thank you. All right, I'd like to read our land acknowledgement. Before beginning, we take a moment to recognize that here in Nevada, we stand on the land of the Wushishu Washoe, Numu, Northern Paiute, Niue, Western Shoshone, and Nuwu, Southern Paiute. We take a moment to recognize and honor their stewardship that continues into today. With this recognition, we state an intention to rightfully include their voice and respect them as the 27 sovereign tribal nations of Nevada. All right, and now we will move on to agenda item 1, public comment. For those who would like to call in and offer public comment, please dial 669-444-9171 and enter meeting ID 928-4944-5069 and passcode 555555. Is there any public comment at GBC?
There is none at this time.
Thank you. Is there any public comment at WNC?
There does not appear to be.
Thank you. Is there any public comment here at the system office in Las Vegas?
There's none at this time.
Thank you. SCS, is there any public comment on the telephone?
There are no callers at this time, Madam Chair.
Okay, thank you very much. All right, let's move on to item 2 for possible action. The committee will consider approval of the minutes from the February 29th, 2024 meeting.
So moved by Susan Breger.
Do I have a second?
A second, Regent Del Carlo.
Thank you. All those in favor?
Aye.
Aye.
Aye. Any opposed? Motion passes. Thank you. Okay, moving on to the chair's report. I wanted to just provide a few general remarks regarding our Health Sciences Committee. I have spoken with the Vice Chancellor, and there's some wonderful things that we're going to be doing in the next year. I've told him that I'd really like to move the needle on this committee. I want us to do some work that is really going to affect positive change in our state, not only for our institutions, but for the pathways moving forward as our students are graduating from these various programs. So right now, today is going to be especially interesting. We have a great report regarding nursing. And one of the things that we're going to be looking to do is to really make it more seamless as we have individuals and students moving from community colleges to the universities. Rather than them having to take an extra year, we'd really like for it to be more seamless. And so we are a system, so we are going to be working to do that, and you'll be seeing that on some of our upcoming agendas. And today we have a wonderful presentation as well, and it's close to my heart, but it is going to be a presentation on sports betting and college students. And it's a national study that will be presented, and we will be also hearing about a prevalence study here in Nevada that is being done by the International Gaming Institute here at UNLV. So we have some really exciting things that are happening. We're going to move the needle, and I encourage anyone that has any concerns or issues with regard to what's happening in health sciences or any great ideas, please contact me. Okay, moving forward, number 4, we have our nursing programs. Nevada State University and Great Basin College. This is an information-only item. Nevada State University Dean of Nursing, Dr. June Eastridge, and Great Basin College Dean of Health Sciences and Human Services, Dr. Stacy, I'll put on my glasses, Warnert, will present information on their respective institutions' nursing program. I'm very excited to hear from you, and thank you for being here today.
Thank you very much. It's a privilege and honor to be here to talk about one of my favorite topics, something that I'm passionate about, nursing and the nursing pipeline. I'm Dr. June Eastridge, the Dean of Nursing from Nevada State University. And I've been a nurse for 34 years, many of those years in direct patient care, and then combination of teaching and direct patient care, and now, fully immersed in educating new nurses for practice. And so I will, whoever's on the other end of my slides, I'll let you know when I need you to progress those slides, and we will dive right in. So next slide, please. Okay, so today I'm going to give an overview of our programming in light of our mission, which is something that we keep in mind constantly, the purpose that Nevada State even exists to produce professionals for high demand careers, and nursing definitely fits that description. And then I'll talk more about initiatives that we have going on, including the growth that we're intending to do using the nurse expansion funding provided by SB 375. Next slide, please. All right, our program. So with our focus on high demand careers, our primary focus is to offer a Bachelor of Science in nursing. And the greatest number of our students are entry to practice. We call that our pre-licensure track. We prepare students to graduate and take the NCLEX-RN, the nursing licensure exam here in Nevada. And in order to accommodate the students that we serve, which are many of them non-traditional students, second career, first generation students, minority students, we really try to keep our program as flexible as we can, at the same time preparing them adequately for a rigorous career. So we have traditionally had full-time students and then a certain number of part-time students. Part-time nursing programs are pretty rare. And so we have continued to be committed to offering that, because we know that we have students who would not be able to pursue a degree in nursing if they did not have the opportunity for part-time studies. So we have full-time continuous, go year-round, 3 sessions a year. We have full-time summers off, because we know that we have a lot of students who are parents and who have other commitments outside of school. And so we added the full-time summers off with that in mind a couple of years ago. And then we have our part-time that takes twice as long as our full-time program. Our full-time is 5 semesters full-time, part-time is 10 semesters part-time, and they progress year-round. And then we have more recently added a night shift track. And that's been a pretty exciting thing to add in, and has allowed us to make use of our scarce resources at a time when nobody else seems to want to tap into that. So then we also have our post-licensure track, which is our RN to BSN. The nurses who have trained to be RNs through an associate degree program, which is the pathway that I myself took as a non-traditional student, then have the opportunity to progress their career and expand their knowledge and their ability to contribute to the profession through attaining a bachelor's degree. And many of these students then go on to graduate school. So our post-licensure track, which is fully online and caters to the working nurse. Next slide, please. So we had 293 BSN graduates in 2023, and I've broken it down here by track. Combined full-time 137, 28 part-time, and 128 RN to BSN. Our average combined enrollment is around 706 students at any given time. Next slide, please. So there have been some trends in national entry-level BSN enrollments, and you can see here we have on this chart bars that represent 1994 to 2023, which is a good amount of time, and you can see how that the interest in entering the nursing profession has changed over time, and many of us mark time by COVID now, pre-COVID, post-COVID, during COVID, and nursing saw a decline in interest in nursing programs, entry-level nursing programs with the onset of COVID. And we know that nurses really took a hit during COVID. They were frontline. There were more nursing deaths than the rate in the general population because of the increased exposure. And nurses were working long hours, mandatory overtime, and in a lot of situations, mandatory overtime still exists. And so, it really takes a commitment and a desire for anyone who is entering the nursing profession in these times. And so, enrollments in nursing programs declined in 2022, and they came back up just slightly in 2023. And we have seen that same trend affect our applications at Nevada State. If you'll look at the next slide, please. So you can see here is Nevada State nursing program enrollment starting in 2011. So we have 12 years of data here, and we made a really intentional push starting in 2014, which is actually when I came to Nevada State, to increase the nursing pipeline. We were committed to increasing our enrollments, increasing our capacity, and producing more entry-level nurses specifically. And so you can see the great upswing in this graph. And then it kind of leveled out in 2021, 2022, a slight decline, and that goes right along with the national trends. And then 2023, we're starting to see a slight increase in our number of applicants. I'm happy to say that for the last 2 semesters, with increased admissions, we have been able to accommodate every qualified applicant to our program. Next slide, please. So here are our curriculum, and just as an aside, all of the pictures that I have in my slides are actually Nevada State students, Nevada State faculty, the work in action, and it's pretty exciting. So with the pre-licensure BSN, as I've already stated, we have 5 semesters of full-time. In 2019, we did a curriculum revision where we moved some of what had been nursing prerequisites into the program. So our program is actually still a 4-year bachelor's degree, but 5 semesters of that, a little over half of that time is spent in the nursing program as an accepted nursing student, and then 10 semesters of part-time study. Our post-licensure BSN, 36 credits, so it is 12 courses, upper division, and we award credits for prior learning and completion of their associate's degree. And again, that track is fully online. So I do want to mention that all of our curriculum incorporates unitary caring science, which is an addition to a nursing curriculum that really has the students focus on the person that is behind the diagnosis, the person who is experiencing the illness, or the person who is working to maintain their health. We are more people-focused, and we're told by our clinical partners that they see a difference in our graduates, that they care about their patients, that they want to create that environment that is healing, that is holistic, and looks at the whole picture of that patient. And we have been able to commit to training our faculty, and they get a 6-month intensive course as Caritas coaches, based on some funding that we got through a federal grant. Next slide, please. So capacity building, our intentional growth, our goal is to not just grow the program, but to maintain our quality, to maintain our commitment to producing caring nursing practitioners. SB 375 has played a big role in our ability to do that and given us the resources that we need, but we also have some other current initiatives. So next slide, please. So when SB 375 was passed, we launched some expansion plans to increase the nursing pipeline without compromising quality and student success rates. And so this required really a holistic view of our program and a build out of both the operations and the personnel side. So with operations, knowing that there is a decreased interest in the nursing profession currently, we looked at marketing. We want to keep a strong pool of applicants each semester so that we can fill every program seat. We looked at growing our lab capacity. We have been able to hire additional personnel. Our lab initially was open just during the weekdays, daytime hours, and we currently run Monday through Saturday from 7 a.m. to 9 p.m. And so it took a lot logistically to grow that capacity, and that's where we're at today. Grow our clinical site capacity. There's a lot of competition for clinical sites with all of the different nursing programs that have come into the state. And so we have made best use of our resources by expanding our clinicals into the evenings. And just a little note on that, on our application, we ask students what their preference is for their tracks, because we really want to place people in that evening track that could have some night shift clinicals. We want people who function well at night, and not everybody does. And so it's not a random process. We try to accommodate those people. So growing our clinical site capacity, that's a big job. And then including night shift clinical instructors, that's another challenge, to have faculty who are, have graduate degrees and still interested in going in and doing a night shift. So along that line, nurse faculty recruitment has been a challenge. Filling the vacant positions. There have been some positions that we've had multiple failed searches, and it's taken up to 9 months to fill one position. We have used some grant funding to do a recruitment plan, a retention plan. We've got a lot of things that we are doing to retain our nurse faculty, and we have some nurse faculty who were previously students that were graduates from Nevada State. And then, of course, we've had to purchase additional supplies, equipment, and increase our student support, our student success support. Next slide, please. So personnel, we've been able to fill multiple faculty lines. We had existing faculty vacancies, and then we were able to create new lines, but through use of funding to recruit, we've been able to do a little bit of both, existing and new lines. So we had 3 new faculty with FY24 start dates and 4 with FY25 start dates. They started on July 1st. And then we also funded additional part-time instructor hours. Our part-time instructors tend to be working nurses in area healthcare organizations and really, really are an important part of our team. We hired an assistant dean of student success and administration. And we also filled a simulation and lab tech position so we could expand our lab hours. And then after a lengthy recruitment, we were able to identify a suitable candidate and hired a wonderful doctor of nursing who is going to launch an MSN leadership program for us with a goal to start in FY25. And I know our curriculum came through the board quite some time ago, and it has taken us this long to recruit and actually get that ready to launch. And so we are well on that path now. Next slide, please. So our outcomes. We have converted some of our part-time seats into full-time seats due to a decrease in demand for part-time, but we are still committed to maintaining as many part-time seats as we need. And so we are going to be graduating more students quicker with that addition. Greater interest than anticipated in our night shift scholars track, which, by the way, was planned before SB 375 with a grant that was funded by the Department of Education. So we admitted our grant-funded track in January 2024, and then due to the popularity, we admitted a second cohort in August 2024. And we have been able to increase our student retention and persistence. We've devoted some resources to student success, and I think that combined with we saw a dip in our retention with COVID and shortly after, and I think we're coming out of that dip as well. So the combination of those two things, we're seeing our retention come back up. So we're launching our MSN. We have been able to hire more administrative support for all of the work that's involved in this growth. And you can see in the table that we had our pre-funding FTE admissions compared to our post-funding FTE admissions. And beginning in spring of 2025, which is just around the corner, we're going to graduate the first of the students that were added due to the SB 375 funding. So we're going to see our graduates then start to go up in spring of 2025. Next slide, please. The night shift cohort, that was the other initiative that we're now on our second cohort. This is our full-time track. This is a full-time track, 5 semesters, approximately 20 months. And all classes, labs, and clinicals for these students are offered after 3 p.m. And then another thing that I'm very proud of, our simulation lab was able to achieve provisional accreditation through the Society for Simulation in Healthcare. And this just shows the quality and the eye for detail that we have in our program. And Director Nina Marcellus, who is certified in simulation education, has been a great leader for that. But we have only been open since fall 2021 and have not had enough data collected for outcomes to have full accreditation, but we will in the next year have full accreditation, I'm quite confident. So next slide, please. We're within the funding period for 4 federal earmark grants. We have our technology enhancement grant, nurse educator recruitment, development, and retention, which is really interfaced well with the SB 375 funding. Our original night shift scholar cohort, and then a academic practice partnership with Henderson Hospital, the nurse transition from academia to practice, trying to have our graduates more practice ready as they leave us. So we have other quality improvement initiatives. We have continuous quality improvement initiatives, but currently we have been working on a 3-pronged mentorship program for new nurse faculty. We want nursing faculty who come from the clinical practice and make some sacrifices in order to do that. We want them to be happy as nurse educators and well-trained. So we'll be collecting data on that initiative as well. Next slide, please. And then to top it all off, nursing education has been going through a big change that was initiated by the American Association of Colleges of Nursing when they updated the essentials for BSN nursing practice. The Essentials of Nursing adopted in 2021. So we're wrapping up the 3-year project of aligning our curriculum to the new competencies that are contained in that document. And they will be required by our accreditor beginning January 2025. And so we're right on track to have that work, that transition accomplished as well. Next slide, please. So looking ahead, we're looking forward to launching our MSN leadership program and continuing to build our capacity. We know that Nevada is desperately in need of new nurses, and we want to do our part to contribute to that. Next slide, please. All right.
Thank you so much, Dr. Eastridge. It's a wonderful presentation. What you guys are doing out there at Nevada State is just incredible, and I think it's just a wonderful program. What I really loved is just how flexible you are. I mean, really, that is the key. It's meeting people where they are in their life and getting them to where they want to be. And so that flexibility is just incredible. It says so much. And finally, I just want to say I love your people focus. I think that so often people go and talk to their providers and the provider's not listening to them. The provider's not saying, how do you feel? I mean, you're just basically diagnosing and you're not really talking to that person. I love the people focus. So I just wanted to say thank you for your presentation. It was wonderful. Do we have any questions? I do want to kind of move it. So we'll go ahead, Regent Brager.
And I'll be very quick. Susan Brager for the record. So for me, I've really been honored to serve at UMC 12 years, Southern Hills for 5, and Chamberlain Nursing School. So it's kind of given me a wide view of what happens out there. How do you compete with, like now Southern Hills has Galen, because they're able to offer them positions and help pay for their tuition. And I know that we've kind of have one more presentation just in this field, but how do you, or you're welcome to get back to me even on being able to compete with that? And, we have all these fractured Chamberlain and Galen and, Henderson and all this. How does that, and if you want to share that later, you're welcome to because of time also, but that just interests me of how we compete as a university system versus these independent factors.
Yeah, that is a big challenge, and that's something we grapple with every day.
Okay.
And I would be happy to send you a note and let
Okay.
you know what we're doing specifically.
Or I'm even happy to sit down with you and see how we work on that, because that really it gives us more nurses, but it takes away from the system we're trying to provide it from, and economically so. So I appreciate that, because then placements and all that become a little bit more challenging, I would
Yeah.
think.
For some of the programs, and of course not all of them, are graduates from those programs have such a huge amount of student debt because of the cost of the programs, where we're trying to provide at a low cost for Nevada citizens, a really high quality program that meets their needs. So I think.
Let me ask, and not to interrupt you, but so that we can, I know there might be others, and let me ask one quick question then. So let's say I'll just use Southern Hills or UMC example, or even though they're being educated through our system, is there a way we could work with them, or they might be able to help with their debt so that they can go right into their systems and maybe say they'd stay 3 years? Maybe that's something, and we could look at in the future for any of our hospitals within our system or our state, that we could then keep our students here and know that they make a 3 to 5 year commitment, and they would help with their funding. Maybe we can work on something like that through the chair. So thank you.
I love it. Do we have any questions at Western Nevada College?
Chair Goodman, I do. This is Regent Del
Go
Crow.
ahead.
Thank you. First of all, I just want to say it's an amazing body of work over the past 10 years, Dr. Eastridge. And on your very first slide, you've got 1, 2, 3, you have 5 different accreditations. So to start as an RN with a 2-year program and to go all the way to a PhD and just continuous improvement in knowledge is just fabulous. I would like to ask a little bit more on this all curriculum anchored in unity caring science. It's a 6 months intensive course with coaching. Could you tell us a little bit more about that? Because I think as a society, sounds like we could all use this course.
I agree. And, one of the things that we're trying to accomplish through this is to increase the level of professionalism and civility in the nursing workforce. It's not only about treating patients with care, but our faculty, when they go through this program, they really learn what caring is and what caring is not. Caring is not low standards or enabling or anything goes. Caring is providing a pathway and providing the resources and, supporting success and supporting people to be their best selves. Because we know that we have to create an environment in busy healthcare organizations. We have to create an environment where patients don't feel like they're just a number or they're just a diagnosis. And so there's very strategic ways to do that. And caring doesn't even have to take more time. And a lot of times nurses, especially those who have not been trained in caring science, will say, well, I don't have time for that personal touch. Well, if you do it right, it doesn't take more time. It's about how you do what you do. And so, that 6 months intensive really does a deep dive into what caring is and what it is not, and how to look at the patient holistically, and then how to convey that to students who come from a lot of different backgrounds. We all do, but caring is universal. And so there are specific ways to approach caring, and we want our faculty to be well-versed in being able to share that with our students.
Thank you so much.
Thank you so much. Do we have any other questions? Okay, thank you so much, Dr. Eastridge. What a wonderful presentation. Dr. Warner, is she up at Great Basin?
I am at WNC.
At WNC, sorry. Hi.
Hi, my name is Dr. Stacy Warner. I am the Dean of the Health Sciences and Human Services Department at GBC, for the record. And I am excited today to talk to you about our nursing programs at Great Basin College. Next slide. This is the agenda for my brief presentation today. And I wanted to start out by talking about how Great Basin College, and specifically our nursing programs, are serving rural Nevada. And our nursing programs are serving rural Nevada in two ways. The first way is by offering educational opportunities to students in our rural communities. Students have an opportunity to obtain a degree and seek a career in nursing. And the second way is really by providing a rural nursing workforce in Nevada. We know that students tend to stay and work in the communities in which they are educated and trained, which is true for our programs. And our Associate of Applied Science nursing program is located in Elko, Ely, Pahrump, and Winnemucca. And GBC has campus locations in each of these towns. Our students attend class on campus in these locations, and we use synchronized distance learning. So we have one cohort of students that are located in 4 different areas. So what that looks like is when they come into class, we have instructors at all 4 locations, but we share the workload through our faculty, our nursing faculty. So when our students come to class, they might have an instructor in front of them for one class, and the next class or the next class section, they would have their instructor live in the classroom on a television screen. And our faculty have worked really hard to build a cohesive cohort using this model. And it allows students in their own communities to come to class, get an education. We also have full nursing laboratories at each campus. And these labs include high fidelity simulators, simulation equipment, all the hospital equipment and resources the students can need to get that hands-on learning in the lab environment before they go out and work with patients. And then our students also attend clinical in our local hospitals, community clinics, and other community partnership facilities in our rural locations and sometimes in the outskirt rural areas as well. GBC also has an RN to BSN program, so that's our bachelor's program, and it's fully online. It's designed for our students to our students and other RNs to advance their degree options, their career, and obtain that bachelor's degree. The program has a focus on leadership and serving rural and underserved populations. So through that curriculum, we are developing rural practitioners, nurses, and developing their skills to really serve our rural areas. This is our admission information for our programs. We admit once a year, and we do operate in small communities, so our programs have small numbers, but we do know we're making a big impact in rural Nevada. And as Dr. Eastridge highlighted, our admission numbers have declined post-COVID. Those are the results of the pandemic. At GBC, we also attribute this to our expansion of our healthcare program offerings. In the last few years, we've really expanded the options for students in rural Nevada. We've added a medical assistant phlebotomy EKG program. We're starting a respiratory program and a sonography program, and those are our 3 most recent programs. So students interested in healthcare now have more options to choose from. It's also helping rural Nevada. Nurses play a huge role in the nursing workforce or in the healthcare workforce, but healthcare is a team. So we're providing more options for students and more providers in different areas in our rural communities. But we do have ways that we're thinking to increase the pipeline specifically for nurses, and that has to do with the SB 375 initiatives and things I will talk about in my presentation. Next slide. Our associate degree program our Associate of Applied Science program is our entry to practice program. So this is where students will graduate with an associate's degree and hit the nursing workforce and start working as RNs. Our program does have a 100% NCLEX pass rate, and we've had that pass rate for the last 3 years, and we have a long standing of having a high pass rate, so our students are successful in passing the NCLEX and becoming quality providers. We have a 94 to 97% job placement rate, and over 80% of our students stay in rural Nevada. So we know that our students are staying and living and working after they graduate in our rural communities and taking care of our rural citizens. And even 90% stay in Nevada. So the few that stray away from our rural areas are really going to our Reno or Las Vegas areas. Next slide. The SB 375 funding we have used in targeted ways to increase and improve our nursing enrollment and pipeline. The things that we have done are, for addition of faculty and staff, we've added a nursing director, a nurse navigator, and the role of the nurse navigator is to work from recruitment through graduation. So her role is to start with the recruitment, advisement, enrollment, and then retention of our students to graduation. We've added 2 full-time nursing instructors. We've added 1 in Elko and 1 in Pahrump. It says Pahrump twice, but 1 in Elko and 1 in Pahrump, and then we're searching for a 3rd instructor in Pahrump. And the reason why we targeted Elko and Pahrump are because those are our communities with the largest population, and those are our areas of highest potential growth for enrollment. And then equipment. We purchased 2 high-fidelity simulator mannequins, and that was to provide, we do have 4 labs that we're maintaining for the nursing program, and it's to provide equity between our 4 labs. We do have plans. We have some cost savings due to the length of time it takes to recruit high-quality nursing instructors, which is hard. Dr. Eastridge talked about this as well, which is even more challenging in our rural communities. And so we plan to use potentially some of the cost savings for medication dispensing cabinets to provide that equity again between our labs, and potentially hiring retired faculty to tutor or coach students to focus on that retainment of nursing students. Next slide. And so really our efforts are targeted to increasing the rural nursing workforce and maintaining quality nurses in our rural communities. And that starts really from the beginning. We start with our CNA course enrollment, that's Certified Nursing Assistant courses. So having consistent CNA course offerings with full-time faculty support. Our 2 new faculty members that we hired with the SB 375 funding are also teaching CNA. And with this, we've been able to open 2 extra sections of CNA this fall, and both those sections are full. And so we're really working on building that pipeline of students, starting from the beginning of that nursing practice and through the program. Our nurse navigator is working to heavily advise students, and that's not just advisement, but following them to enrollment, following up with them and making sure those advisements turn into enrollment, and students are continuing to enroll in those prerequisite courses to then come into the nursing program. We want to provide continued student support in our programs as well. Our nursing faculty have started to offer weekly review sessions to support students every week and make sure that they're successful in the program. Our nurse navigator, we're also using as a liaison between faculty and students as needed, being an extra person to reach out to students when faculty have counseled students, provided an academic plan, and making that connection back with faculty or asking students, have you been following your plan, or do you need to make another appointment with your faculty member? And then lastly, we just are continuing to offer those opportunities to students. We have 4 rural locations. Students live in these communities. They also live in even smaller rural communities in the area, and they travel to our larger rural campuses. And then lastly, what's brand new this fall is we've created a new pathway for students interested in nursing, which is our LPN/paramedic pathway into our nursing program. Next slide. And we've just started this fall, and so it's an entry point into the program, and it's for licensed paramedics and licensed practical nurses as a way to advance their career and degree to become a RN. So how this is working is they will take a bridge course that's bridging their experience or practice experience in their previous education with the beginning of our nursing program, the fundamentals of nursing. And so they can come right into our 2nd year of the nursing program. Our nursing program is a 2-year-long program, 4 semesters, 2 years are traditional. And so then they're coming into that program with our other nursing students, and they'll graduate. So we have admitted our first cohort this fall at 3 of our locations in Elko, Winnemucca, and Pahrump. Next slide. And looking to the future at Great Basin College, we do live in small rural communities, so we expect to see gradual growth over time in our nursing program as we're building this pipeline, getting the excitement for nursing, building students up to enter our nursing program, and then retaining those students. So we'll see the impact of the SB 375 funding and our initiatives gradually over time. We know that we continue to have an impact in rural Nevada and our communities. We go out to our communities. If we access healthcare, we see a lot of our nursing graduates. And for GBC, the biggest thing is retainment of faculty and support staff is crucial to the success of the nursing program. Having faculty to support the students at the 4 different locations, being able to take them to clinical, being able to offer this opportunity for students in their own communities where they might not otherwise be able to obtain an education, as traveling to our urban areas is not something that they're able to do. Next slide. That concludes my presentation. Thank you. If you have any questions, I'd be happy to answer them.
Thank you so much, Dr. Warner. What a wonderful, I'm hearing feedback. It was a wonderful presentation. I love that you are retaining 80% of your nurses in rural Nevada. That is incredible. It's just really great work. And I also wanted to mention that I loved your pathway. I loved that almost last slide. That's incredible. So thank you for all the work you're doing. This is such an integral piece of what we need to do for our state. So I appreciate you. Does anyone have any questions?
Chair Goodman? This is
Go
Regent
ahead,
Del Carlo.
Regent.
Thank you, and thank you for the presentation. And I think you're new to us because you're new in your position. So can you just give us a little bit, because for many years we've seen interim President Dinelli, and she's been the face of nursing and everything else up there. So can you just tell us, because we're going to be seeing you a lot more, I think.
Yes, I'd be happy to. So actually, I'm new to the dean role. I assumed the dean position January 1 of this year. But I'm not new to Great Basin College. I've been at the college for over 11 years, and I've taught in the nursing program. So the nursing program is near and dear to my heart. I am an RN. I graduated from UNR, and then I relocated to Elko, Nevada, and entered nursing education, which I love. So I'm not new to GBC. I've been nursing faculty for many, many years. And then I'm very excited to be in this dean role. No.
Thank you for the information. I just have one follow-up question. A point of pride for GBC is their 100% pass rate on the NCLEX, is that the name? And what is do you know the national pass rate for that? Because, 100% is amazing considering how far all over rural Nevada, frontier Nevada you are. Do you know what the national average is?
Off the top of my head, I don't, but I can get back to you. I believe it is in the 80s versus the 100s. So, but I can get back to you on a specific number.
I know all of our schools do very well, but you really do set the standard on that one. GBC does. So thank you.
Oh, I'm being told it's 79 currently. So.
Thank you so much. Thank you so much for your presentation.
Thank you.
Okay, our next item is the prevalence of sports betting among college students. Our UNLV project manager for the Nevada Problem Gambling Gaming Project, Andrea Desopoulos, will give a brief presentation on the prevalence of sports betting among college students. This is some really compelling information. As you all know, sports betting is it's legal in so many states now, and Andy has a wonderful presentation for us. Full disclosure, this is close to my heart, and this is my space where I work, and I thought it would be important to obviously share some of this information as we talk about mental health and our students on campuses. So, Andy, take it away. Thank you.
Yeah, hi. Thank you for having me today. I am Andy Desopoulos. I am the project manager of the Nevada Problem Gambling Study, and I'm also a doctoral candidate in sociology at UNLV. And so what we do at the Nevada Problem Gambling Study is to provide evidence-based solutions to Nevada's gambling problems. So we do everything from large-scale population surveys to intensive qualitative studies. We do program evaluation. So anything related to problem gambling in the state, we are involved. So right now we're focusing our attention towards college students and their gambling, which we're very excited about. Next slide, please. And so you may be aware that since 2018, sports betting has expanded to 27 states. It's become a large industry. And it's really largely based on, or sports betting is happening using apps, and it's become a lot easier for college students to become involved in sports betting. And just as the whole industry expands and the advertising of the apps and of different ways to bet, it's really just become a normal part of sports fandom. And so college students are already at higher risk for developing gambling problems, but now with this expansion of sports betting, it's just multiplied. So just thinking a little bit about why students are getting our special attention. So as I mentioned, students have a higher prevalence of gambling disorders. And so what exactly is that number, you ask? Well, we don't know, because it ranges from 2 to 5 to 6 to 10, depending on who is measuring it, how it's measured. So there's just this wide range. And so 6% is largely quoted as the number, but again, this is an unreliable number. We really just do not have enough data to say how much college students are betting and how many of them are experiencing problems. So that's why we are starting this survey, and really want to look at college as a critical developmental stage, a time when people are more susceptible to influence and making these behavioral changes that'll stay with them over a lifetime. So understanding gambling at this time is really pivotal, especially in trying to focus on interventions and being able to provide timely interventions at the college level. So we can use this data to inform universities, find opportunities to work with colleges to develop programming, to create sort of mitigation efforts. And of course, this is a public health issue that goes beyond the university. This affects the whole state. It affects financial stability, mental health, academic performance. They're all really in jeopardy when students develop gambling problems. And in addition to students' gambling problems, students are also dealing with gambling problems of other members of their family. So we want to just get a baseline data on, what's going on with students in our state. Next slide, please. So as you can see, this is not unique for us. This has been very of interest in the media. In other states are also conducting statewide student surveys. The NCAA released a very large study in 2023, and I'll just give you a few of the highlights of their findings. Next slide, please. So prior to the 2023 survey, we already knew that gambling disorders were much higher. So up to say 10% in college students experiencing a gambling disorder versus 2 to 5 in the general population. But in the NCAA survey, 16% of college students have engaged in at least one risky behavior. 6% reported that they had previously lost more than $500 on sports betting in a single day. 70% of these risky gamblers believe that consistent sports gambling will increase their monetary earnings. So these are cognitive distortions which are associated with gambling addiction. So this is something very specific that we could address to give people the right information, to make the right decisions about their gambling. Next slide. So again, 60% of all college students were found to be engaging in betting. 60% of students living on campus were betting at a higher frequency. So those who are, under our care and supervision are betting even more than others. 41% of college students who bet on sports had placed bets on their school teams. And this brings into question all kinds of integrity issues, campus climate issues, things like that. 35% of college students who bet on sports had used a student bookmaker. So this is illegal, and this is something that we should be protecting our students from. So we really need to know what's going on in Nevada. Next slide, please. So given that, we've had sports betting in Nevada for a long time, we have a unique relationship to gambling compared to other states. So we can't really use this national data and apply it to our students. Although our students still face the same vulnerabilities, but we need to know how many Nevada students are experiencing gambling-related harms. How does Nevada compare to other states in terms of student betting, gambling, and what kind of resources do they have for help? Are Nevada's students aware of the resources for help that we have in the state? What can we provide to them at the college level? How can we direct them to the other state resources that we have? So I'm really excited. Next slide. I'm really excited about our next student survey that we're launching this fall, hopefully. And hopefully I'll be back here soon to present results.
Thank you so much, Andy. It's a great presentation. It's incredibly eye-opening, and I love that you're going to be doing the Nevada prevalence study. Do we have any questions, Regent Brager?
Is this something, information, I know I don't take the elevators a lot at UNLV, but could we have something, a brochure or a statement in there? I don't know if there is anything now, but to me, they do things like there's going to be an event here, an event there, maybe something that's kind of sublineal. They read it all the time and they're able to know maybe there can be and maybe there is a hotline where they can call without being, identified to ask a question. Because I would presume it would be an embarrassing addiction to come. All addictions are embarrassing, but it's in probably every family and everyone doesn't know how to handle it. So that would be just a comment that maybe they'd be able to get some more information without having to call someone or ask for something. But thank you for an amazing presentation, and it's so worthwhile and so important.
Thank you.
Do we have any questions up at Western Nevada College?
Yes, Bruce, this is Regent Del Carlo. Thank you.
Go ahead, Regent.
Yes, and thank you, Chair Goodman, for putting this on the agenda. I think it's very important when you look at the whole scope of a student. I'd like to go back to slide number 4. I think it's 4 with the bullet points. And that last bullet point really stood out to me, that 70% of these risky gamblers believe consistent sports gambling will increase their monetary earnings, and that there are the cognitive distortions associated with it. That's the beginning of addiction. So that's a lot. That's a high number, number one. And then do you in your research know before they get up to that 70% what those disorders are that you can identify in people, or that people should self-identify it to avoid this? I don't think, do you understand what I'm kind of trying to say? Because I've known, I knew a problem gambler, and they really did. They think that the more they're going to win, and they get that high, that emotional high, and then they lose, and then it's down and depressive again, and then they gamble to get it back, the high. Is that all part of that?
Yeah, that's definitely, chasing losses is definitely one of the indicators of a gambling disorder. As far as cognitive distortions, we know that people with gambling disorder tend to have higher rates of cognitive distortion around gambling. And one of the things that, one of the intervention is just sort of early awareness, being made aware of what are your odds of winning? What is the, if you keep playing, will you eventually win? Things like that. Those are ways that you can sort of have gambling knowledge. That doesn't really prevent gambling disorder. People still develop disorders even when they do know that they can't win. But that is something that is protective of all people. So a lot of people will experience gambling problems without having a full-blown gambling disorder. So for those people, just basic information about gambling can be a great intervention.
Thank you.
Super. Do we have any more questions? Thank you so much. And just so everyone knows, we will be working with the state. There is a campaign that has been put together to talk about gambling and the number you can call, 1-800-GAMBLER. And we'll be working with CASAT to see if we can get those distributed to all of our varied health centers throughout all of our varied institutions so that students know they can call a number and access help. So it should be great. Thank you so much. Moving forward. Do we have any new business? Seeing none, we'll move forward to public comment. Is there any public comment at Great Basin?
There is none at this time.
Is there any public comment at Western Nevada College?
No public comment.
Is there any public comment here at the system office in Las Vegas?
There's no public comment at this time.
SCS, is there any public comment on the phone?
There are no callers at this time, Madam Chair.
Thank you so much. Well, with that, I will adjourn this meeting. Thank you.